Okay. First hantavirus, now Ebola. Which one are they gonna pick? Let's check this out right now.
And Ebola travel restrictions forcing the United States to divert a flight headed for Detroit. Homeland Security sending the plane to Montreal instead. The passenger from the Congo boarded the flight in what officials say was an accident. The U.S. currently has travel restrictions.
Wait a minute. It's like, you ain't landing here. Put them in Canada.
On 3 African nations where Ebola is spreading. They will be in effect for the next 30 days.
Okay, with that now, the growing concerns stem from an American doctor working in Central Africa testing positive for the disease.
I heard about that.
He's being treated now at a hospital in Europe, Germany to be more exact, and health officials with a worrying update a bit earlier today said this.
This outbreak is not small. I have described
not small.
This outbreak as...
Hopefully she's not telling the truth. Hopefully she's fibbing.
Being like an iceberg. We've seen the top of the iceberg. I think the WHO is now into the many hundreds of cases and hundreds of deaths. But the truth of the matter is that real numbers will be much bigger than that. This requires all hands on deck, and that is what we're seeing here, and it is materially different to 2014.
Okay, now Dr. Marc Siegel, Fox News medical senior analyst, now author of the New York Times #1 best-selling book, Miracles Among Us, and he's with us now. And Doc, good to see you. Good day to you. Here are the numbers: 130 deaths in Africa, at least 540 other cases between Uganda, the Democratic Republic of the Congo, the DRC.
God.
Got this American going to Germany. What concerns should there be?
Man, let me tell you something. We had an Ebola outbreak. I ain't going nowhere. Everything getting delivered to the house. Everything. And I'm gonna be in a hazmat suit when anything comes.
Now that are relevant to us, Doctor.
Well, Bill, first of all, Democratic Republic of Congo is where most of them are, the vast majority. 2 cases in Uganda, Rwanda, they're keeping a very close eye on. I think the numbers are more like over 1,000. I want people out there to know that this requires very close spread. Most of the cases originate from poor burial practices, actually. You really have to get in touch, very close contact with secretions for this to spread. It isn't from breathing it. And so that's good news, although this particular strain, Bundibugyo, which hasn't been
makes me wonder if she's like traumatized, if somebody died and she heard, and she's just like,
dominant strain has kind of escaped the radar of public health authorities, so there's no vaccine for it. We have a vaccine for the Zaire strain, which is actually a live virus vaccine.
I'm sure you do. I'm sure they do got a shot ready.
It's quite effective, about 80% effective. So they're in development for a vaccine for this, and they should have it in about 6 to 9 months. And Bill, unfortunately, this outbreak is going to last for probably more than a year. But the Americans should be reassured that the chances of it coming here or having any kind of sustained spread here is 0. And the CDC is absolutely right.
0? I'm going to remember this. 0.
To give travel warnings about traveling to these countries, because we don't want to see
jump in there.
Even a single case.
Yeah, I know you said 0. Ebola symptoms are the following. Would you show our viewers this? On average, 2 to 21 days after exposure, fever, ache and pain, severe headache, weakness and fatigue, sore throat, loss of appetite. You get the idea. That woman in Geneva during that soundbite referred to 2014.
He just glossed over the last 2, didn't he? Just etc. Unexplained bleeding and gastrointestinal symptoms. I'm gonna look up this. Y'all know me. I'm gonna look up this damn sickness here and find out exactly what gets rid of it.
Geneva during that soundbite referred to 2014, 12 years ago. There was a case of an American who was flown back into JFK in New York and taken, I believe, to their apartment on the Upper West Side of Manhattan. This was a huge story, Doctor.
Huge.
And the local affiliates were following the transportation with their news helicopters. There was a lot of concern as to whether or not we were importing Ebola into America. It didn't happen then. You're saying now it won't happen?
I'm saying there's a chance that we could see isolated cases here, but it's very, very low. We see these outbreaks every year or two. I also remember Dr. Craig Spencer, who I just interviewed last week, who was a physician working in that area like Peter Stafford now, and ended up in Bellevue Hospital for 19 days. He recovered. But the death rate from this is 30 to 50%, and it can cause hemorrhagic fever. So it's an extremely dangerous virus, but it is not very contagious. So that's why the travel restrictions help.
Okay.
I think the bigger
Dangerous,
issue is how do
but
we
not
control it over
contagious
there?
virus.
Okay, let me move
Not
to
very
hantavirus.
contagious.
Still out there, still a concern. You were in Nebraska with a Dr. Stephen Kornfeld. So there's one of these victims who apparently doesn't want to stick to quarantine. Let me ask you about that. But first, the soundbite from Dr. Kornfeld. Watch.
The level of biosecurity that I have been through and still am going through is very high level. There is no way virus is getting away from anybody who's been through this process. At the same time, we're all people, we're scared, we're in a strange location, we're away from our family. People were really trying to make sure that I was being looked after, not just from a viral standpoint, but from a human standpoint.
So he was the doctor on board that ship. I remember when you were in Nebraska, and the biggest concern is whether or not the patients who were there would break quarantine. I think quarantine was 21 days. And apparently one of those in quarantine doesn't want to...
42 days.
42, okay. Apparently a woman doesn't want to stay in quarantine. What do you know about that? What are the implications, do you think, Doctor?
I talked to every quarantine expert and director there in Nebraska. Dr. Brett Major, Dr. Willett, these are great doctors, and they kept making the same point. We're okay with it, people going home if they have a proper thing in place at home where they're not directly contacting anyone, and when they have where they have an emergency plan. That's what the CDC is saying. And Dr. Jay Bhattacharya, the acting head of CDC, he's saying, look, these two people, maybe they don't have a plan. Maybe they don't have exactly the right place to go. That's important because we don't want to see the hantavirus spread. But Dr. Kornfeld said something amazing there. He said it's the human touch that's important. It isn't just protocol. How are these people being talked to? And I found in Nebraska that these were very human doctors that showed kindness. So talk to them with kindness, but we don't want the general public put at risk either.
All right, good stuff. Doctor, thanks for coming on. Dr. Marc Siegel on a Thursday morning. Good to have you, sir. Thank you.
All right. Well, folks, make sure you stay updated. I'm going to go do some research. 10 million subscribers.